هسه واضح بابا؟
اي واضح دكتور.
واضح طلاب تسمعوني؟
اي واضح دكتور.
يلا. بسم الله الرحمن الرحيم، وعلى بركة الله نبدأ محاضرتنا لهذا اليوم المصادف الثلاثاء 18 شهر الخامس 2021، وهي المحاضرة الثالثة من بعد الفصل الثاني أو نصف السنة. Good morning، وأيامكم سعيدة وكل عام وأنتم بخير، ونتمنى لكم الصحة والموفقية والعافية إن شاء الله. So today our lecture is going to have an idea about the salivary gland diseases. The salivary gland disease, and today we are going to have more idea about the diagnosis of the salivary gland. How we are going to make a diagnosis of the salivary gland. At the beginning, I'm going to give you the general points that we are going to concentrating regarding today. In order to know the diseases and in order to know the disorder that may associate it with the salivary gland, we are going to spotlight on the following. First of all, we are going to have an idea about the type of the salivary gland that we are concerning about, whether it was major or minor, the location of the salivary gland, the opening of the salivary gland inside the oral cavity, regarding the parotid, the submandibular, the sublingual, and we are going to have the different modalities of diagnosis. We are going to have an idea about the way that we could make an accurate diagnosis to the patient and the sign or symptoms of the salivary gland disorder. Knowing all the above that I had mentioned before, in order to reach the diagnosis, need to know the anatomical structures of the salivary gland. And as we know, three types of major type of the salivary gland is usually consist of parotid and the submandibular salivary gland and the sublingual salivary gland, which is located at the floor of the mouth. The parotid, the submandibular, and the sublingual. And we could see that the parotid and the submandibular gland each drain into the mouth in a single long, here we could demonstrate it, in a single long duct. The sublingual gland drain the many small ducts into the oral cavity. So knowing the anatomical structures of the salivary gland is very important. Therefore, the parotid gland is going to divide into superficial part and the smaller deep loops, which is located behind the ramus of the mandible. And between them, the mandible or the facial vein is going to be represented, which is it's located posterior to the ramus of the mandible and drained via the Stenson duct. And as a general token, transferring superficial to the masseter muscle and passing through the vaccinator muscle before it is going to be passing to the oral cavity. ونعرف الدكت مالته تدعى بالستنسل duct والlocation مال opening of the parotid gland is usually located at the second maxillary molar. Here we have to know that the distal part of the facial nerve and it is considered to be as the terminal blast pass through the parotid parakinia. ولهذا راح نشوف دور الفيشل نيرف يكون كلش مهم in case of any parotid gland disorder. هذا هو المقدمة. نعرف علاقة الفيشل نيرف بالباروتيد gland, and it is considered one of the alarming system if the facial nerve is going to be involved. And the most important things, there are multiple lymph nodes which is located superficial and within the parotid gland, which is actually, it may give us an indication whether this lymph node is going to be swelling or no. And the most important things, it is very difficult to differentiate or to diagnose the deep salivary, the deep lymph node which is located inside the parotid gland. Furthermore, the accessory parotid gland, sometimes we could notice in a 20% or 25% subject, which is usually located anterior to the main parotid and superior to the Stenson duct. Another anatomical structures and information regarding the submandibular salivary gland, which is considered to be the second large salivary gland. Location مالتها مثل ما قلنا بالفلور of the mouth adjacent to the posterior body of the mandible, along the free edge of the mylohyoid muscle. And here we could demonstrating that the adipose tissue which is located in the submandibular gland is lower than that representing on the parotid. مثل ما قلنا الفيشيال nerve is considered to be one of the most important structures which is located inside the parotid gland, which may give me hints about a serious condition if it's going to be involved. Here we could demonstrating that the lingual nerve and the submandibular ganglia are noted superficial to the submandibular gland. And another important structures is the hypoglossal nerve. Then the lingual nerve with hypoglossal nerve is going to be involved if there is anything is going to be affecting the submandibular salivary gland. And as a result, all the area which is going to be supplied by these two important nerves, here lingual nerve with hypoglossal nerve, is going to be involved when the submandibular gland is going to be involved by any swelling, whatever this type of swelling is going to be occur. إذن structureين مهمة بالسبمانديبولار salivary gland اللي هي اللينجوال نيرف والهايبوجلوسال نيرف، طبعا هو المسؤول عن الموفمنت اوف ذا تانج، واللينجوال نيرف اللي يعطي ايضا للتيست باد وغيرها. It is very important structures which is going to be affected when the submandibular gland is going to be infected, whatever, by infection or by swelling, by tumor, and so on. And it is going to be drained into the Warthin duct in the anterior sublingual region. Another important structure اللي تدعى بالsublingual salivary gland, which is considered to be the smallest major salivary gland, adjacent to the anterior mandible in the parasympathetic location, superficial location. And here the Warthin duct and the lingual nerve separate the sublingual duct from the medial genioglossus muscles. إذن هناك الجينوغلوسس muscle اللي تمتد من الجينويد إلى الجلوسس muscles. Here the Warthin duct والlingual nerve separate the sublingual من هذه المسلز. إذن هذا السبلينجوال gland من ناحية تشريحية from the anatomical structures is located on the genioglossus muscles, and the Warthin duct which is going to be open حنشوف الاوبننج مالتها واللينجوال نيرف راح يفصلها. لكن لاحظ الاوبننج مال السبلينجوال gland. It's very important because it is going to be open through multiple ducts. في بعض الأحيان 20 تدعى بالducts of Ravenous directly into the floor of the mouth along the sublingual papillae. And sometimes these duct is going to be unit with each other to form the parotid duct and drain into the Warthin duct. And the only encapsulated major salivary gland that provide 3 إلى 5 من التوتال saliva. إذن أعيد بصورة مختصرة هناك parotid، هناك submandible، وهناك sublingual. الباروتيد اهم ستراكشر يكون موجود بيها الفيشل نيرف. السبماندبل تايب اوف ذا سيليفري جلاند يتم التركيز على اللينجوال نيرف والهايبوجلوسال نيرف. اما بالنسبه للسبلينجوال جلاند ارجو انه تنتبه طريقه how it is going to be open into the oral cavity. Sometimes these duct is going to be unit with each others in order to form the parotid duct, which is considered to be as an important structure which is going to be drained into the Warden duct. بصورة عامة تقسم السليفري gland either it is going to be divided into major salivary gland and into minor salivary gland مثل راح نشوف المواقع مال minor salivary gland. أيضا it is going to be divided according to the type of the saliva which is going to be secreted and the type of the cells. That is to say the parotid is composed primarily by serous cell. Submandible هي mixed serous والmucus. والsublingual هي mucus type. And if you want to know the difference between these, the serous produce more watery. The mucus secrete a more viscous fluid with salivary glycoprotein which is called the mucin. Even in the mucus cell تعطي more vesicles, while the serous it is going to be give more watery. لاحظ الفرق between the type of the saliva and the type of the cells. يعني the type of the cells which is going to be secreted. Type of the cells and the secretion of the saliva. بقى عندي another important structure which is called the minor salivary gland. الماينر salivary gland اللوكيشن مالتها كلش مهم. The first one which is called the von Eber gland تقع بالcircumvallate papillae and the vollate papillae, and it is considered to be as a serous gland. يعني بالposterior junction between the interior 2/3 and the posterior 1/3 يقع ال von Eber types of gland. راح نشوف الموقع مالتها الآن. Look, the position of the von Eber types of the salivary gland. هنا junction between the interior 2/3 of the tongue. هنا تقع circumvallate papillae. Here, the von Eber types of the salivary gland is going to be located. While the Weber type of a gland, which is located along the lateral border of the tongue. This is the lateral border of the tongue, and here we could demonstrating the presence of the Weber types of the gland. Another type of minor salivary gland, which is called the Baldwin salivary gland, which is located here in the interior part of the salivary gland. Okay, and the opening of the salivary gland مثل ما قلنا أول شيء نعرف إنه الباروتيد هي عن طريق الستينسن داكت والسكند مولر مالتها البوزيشن مالتها عادة فيرست مولر والسبماندبل عن طريق الوارتن داكت والسبلينجوال how it is going to be drained to the oral cavity, drained by 20 ducts called the duct of the Rivenus. The largest one of all, the sublingual duct of the parotid type of duct, join the submandibular salivary gland to drain through the sublingual cavity. Here we could demonstrating the different opening of the salivary gland regarding the parotid, the submandible, and the sublingual gland. أعيد كل اللي حكيناه بصورة مختصرة. تكلمنا عن الاناتوميكال ستراكشر، تكلمنا عن التايبس اوف cells of the salivary gland, whether it was a serous or mucus or whether it was mixed, and تكلمنا عن الماينر salivary gland and the location of the minor salivary gland Here we could demonstrating the presence of the Weber gland, which is located at the junction between the circumference papillae, between the anterior 2/3 and the posterior 1/3. At the lateral border, we could demonstrating the presence of the one upper type of the salivary gland, while the interior part of the tongue is usually associated with the blandar and the salivary gland. Here we could demonstrating the presence of the minor salivary gland. الأوبننج مثل ما قلنا parotid extension, submandibular water, and the sublingual gland عن طريق أكثر من 20 axillary duct called the duct of the Regalis. The largest of all, the sublingual duct تبع بالبالاتون وتتحد مع submandibular duct would drain through the sublingual cavity. الكومبوزيشن مال السلايفا مثل ما قلنا التايب مال السلايفا، التايب مال السيلز الموجود بالسليفري جلاند. الان نعرف التايب مال السلايفا ايضا، او the saliva it is going to be consist of water. More than 99 or 99% is going to be representing with the water, and sometimes is going to be representing with the protein, and always present with the protein and salad, the gingival cubical fluid, the microorganism, the food debris, the exfoliative epithelial cells from the mucosa, the mucus, and so on. In addition, it is consist of many trace elements, and it is consist many immunoglobulin, and so on, even though enzymes could be demonstrating inside the saliva. الكومبوزيشن مال السلايفا حاليا هو يعتبر جدا مهم in the many research. That is to say, many of the systemic disease that we are going to deal, this systemic disease is going to be influence the composition of the saliva. It is going to be influence the level of different trace elements inside the saliva. It is going to be influence the type of the enzymes which is representing in the saliva, in addition to the level of the immunoglobulin, level of antibody, and so on. الآن تستخدم السلايفا من أجل تشخيص أو من أجل preliminary diagnosis of most of the systemic disease. We do not want to get further in the subject, but it is, as a general talking, it is important for the undergraduate student to demonstrating that. لدينا يعني كشيء ايضا من اجل الاطلاع باعتبار انتم ان شاء الله راح تتخرجون، لدينا الكثير. We have a lot of research conducting in this field, and we could use the saliva as a preliminary diagnosis of many of systemic disease. We could demonstrating changes in many trace elements, in many enzymes, in many immunoglobulin levels, in most of the systemic disease. ايضا الان saliva could be used as a diagnostic. يعني كل الابحاث الان تتركز في انه السلايفا يستخدم بدل عن السيرم in the diagnosis in most of the systemic disease. وتقدرون تلقون كثير من التاريخ موجوده في هذا المجال وابحاث عميقه موجوده في هذا المجال. Anyhow, اهم complication اللي ممكن يجينا البيشنت يعاني منه بالسيلفري جلاند اللي هو xerostomia or hypofunction of the salivary gland as a general token, or decrease in the salivary secretion. And here we have to investigating about the type of medication that the patient is taking. في بعض الأحيان البيشنت ياخذ antihypertensive, antidepressant, antihistamine, sedative, diuretics, any types of medication which is going to be influence the secretion of the saliva. Further investigation is needed in order to demonstrating whether there was excessive amount of alcohol, caffeine, and cigarette smoking. And even though we have to take into consideration that if the patient previously have been treated with radiotherapy or chemotherapy, it is going to be influence the secretion of the saliva. Another systemic disease like diabetic is going to be influence the secretion, even though the psychological and the malnutrition and sometimes autoimmune disease is going to be affected, like for example the Sjogren syndrome. And then these are the most common causes which may associate it with the hypofunction of the salivary gland. إذا نصورها بسؤال معين. Why the history is important for patient with hyposalivation or decreasing the salivary secretion or patient complaining from dry mouth. طبعا هناك فرق بين الدراي ماوث بين السيروستوميا بين الهايبوسالivation. يعني هذا كله راح نشوفه ان شاء الله عندما نكمل المحاضرات ونقرا disorder and understanding the disorder of the salivary gland. هناك different in this terminology, but the basic principles here you have to investigating whether the patient is taking some of the medication or whether the patient may have a systemic disease. Here we could demonstrating the systemic diseases. Even though sometimes the patient complaining from autoimmune disease, which is going to be affected the salivary secretion. And after investigating of all the organic causes, sometimes we are going to jump to unspecified or undiagnosed condition, for example, anxiety, which is going to be affected the salivary secretion. And those patients may complaining from dry mouth. Investigation, the signs of the hypofunction of the salivary gland. Here we could investigating either extraorally, we could demonstrating if there is any swelling, any symmetrical of the salivary gland, any recurrent type of swelling, and in addition, sometimes we could demonstrating the presence of the candidiasis, or sometimes the viscous or scant secretion. Sometimes a cloudy exudate may be sign of bacterial infection. And here we need to be cultured in order to know the specific types of microorganism which is responsible about that. And as I have mentioned before, مثل ما ذكرتكم في بداية المحاضرة, the most important things and the most of the alerting system is the facial nerve. Most of the tumor of the parotid gland is going to be manifesting as facial palsy or facial nerve who do not respond to any type of a treatment. إذا facial nerve هو يعتبر alarming system، يعتبر the most serious condition مثل راح نشوف، which may associate it with the salivary gland disorder or salivary gland tumor. And sometimes during the extraoral examination, we could demonstrating that there is ulceration of the overlying mucosa. And here, when you could demonstrating any ulcer overlie the mucosa or overlie the skins, which is overlie the salivary gland, please it is considered to be as a serious condition. بالنسبة إلك طبيب أسنان، إذا تشوف هذه serious condition اللي موجودة بالsalivary gland, please do not ignore these types of patient to try to send the patient to further investigation. The most important things during examination, we could demonstrating that there is a hardness of the salivary gland and fixation of the salivary gland with the surrounding area. Even though the patient may complain from pain or tenderness in the salivary gland, sometimes tenderness or swelling of the salivary gland may give us indication about infection, but sometimes it is considered to be as a serious condition. And two most important factors that I always concentrating during conducting your own diagnosis of the salivary gland is the facial nerve involvement. والنقطة المهمة التي لا يخلو امتحان من عندها إلا ونسأل عن الليف نود. مو صحيح؟ وياي يا طلاب؟ اوكي.
نعم دكتور.
نعم دكتور.
انتبه، هاي بحياتك عملية ابني تفيدك لما نشوف facial nerve involvement، لما نشوف lymph node involvement in the surrounding area. And the most important things we could demonstrating that the nerve pulse. هذا مثلا باوع التيومر، يعني بالبداية اختارينا هاي الصورة واحنا بعدنا ما داخلين بالتايبس مال التيومر of the salivary gland. But here we could demonstrating just a swelling. هذول جماعة البيومورفيك أدينوما طبعا يعتبر benign. لاحظ just swelling on the pretragus area of the parotid gland may demonstrating that there is a tumor represented in this area. راح نشوف طرق الفحص وراح نشوف ال characteristic features of any disorder associated with the salivary gland. كيف يتم فحص الsalivary gland? What are the methods of the diagnosis? Today we are going to discuss these into details. كيف يتم تشخيص أمراض الغدد اللعابية. What are the methods which are used for the examination? What are the contraindications? What we could demonstrating in each one here that we are going to investigate. نبدأ بالسيالوغرافي. طبعا السيالوغرافي أنا بالحقيقة بالحياة العملية ما أبدأ بالسيالوغرافي. We start with the non-invasive type of method, like for example the sonography. لكن هنا in the lecture خليتها بالبداية على مود التركيز مالتها يكون أكثر. بعدين راح نتكلم على السونار. لكن from the practical point of view من ناحية عملية do not send the patient directly to the Sialography unless you are knowing the indication and the contraindication. Start always with a non-invasive method. نبدأ بالسيالوغرافي على مود التركيز هنا كمحاضرة. It is considered to be as one of the methods for examination of the salivary gland, and we are going to use it for examination of the parotid gland, which is the major, and the submandibular salivary gland. And here we are going to installation of soluble contrast material. يعني تعطى contrast material اللي هي الايودين يتم اعطائها عن طريق الستنسل داكت بالنسبه للباروتيد، ويتم اعطائها عن طريق الوارنينج داكت بالنسبه للسبماندبل. طبعا بالنسبه للسبلينجوال جلاند it is very difficult because الداكت مالتها too small that it could be easy to inject it for the contrast media. يعني صعوبة not be easy على ما تعطي contrast media للسبلينجوال salivary gland. And here we could demonstrating whether there is intrinsic or acquired abnormality. And we could demonstrating that what we are going to demonstrate متى يتم استخدام السيالوغرافي وماذا سوف نرى بالسيالوغرافي if there is any structures of the salivary gland duct. Sometimes if there is any obstruction that is to prevent the saliva to come to the oral cavity, even though dilatation of the salivary gland duct, if there is any rupture مثل ما راح نشوف, and sometimes it is used to identify whether there is stone or sialothysis. Just a simple stone is located inside the duct, which is prevent the secretion of the saliva, and as a result, the swelling of the salivary gland is going to be occur. Even when we suspect that there is intrinsic structures which is going to be affected, the salivary gland, we are going to give a radioactive material through these different ducts of the parotid or the submandible. راح نشوف الطريقة هنا أكثر. تعطى الكونتراكس media. Then after that, the patient have to wait for about 10 minutes, 15 minutes. Then after that, we are going to take an X-ray to this type of patient. And here we could demonstrating that the tree branch like or leafless يعني blooms of the tree بتكون مثل العفو الشجرة, and the contrast medium introduced into the salivary gland parachemia area. إذا كان عندي calculi, we could demonstrating sialothysis. We could demonstrating whether there is a stone also. Sialodenitis means that there is an infection inside the salivary gland, and the fistula of the salivary gland could be demonstrating. We could see that there is radioactive material is going to be separating into the surrounding area. يعني راح تطلع إذا أكو فاستولا موجودة radioactive material when you are going to inject it into that salivary gland. We could demonstrating that there is a multiple radioactive materials representing our salivary gland. Sometimes if there is any stenosis inside the duct, whatever this type of stenosis is due to swelling, due to stone, whatever, these radioactive material cannot be passed through these duct. And here we could demonstrating that there is a stagnating of the salivary gland duct. The duct as a general token could be demonstrating. And even though if there is any classification, we could demonstrating by this method. ولكن it is not considered to be as diagnosis of the salivary gland tumor. هل يمكن عن طريق السيالوجرافي demonstrating if there is any tumor? Please, we could not demonstrating that there is a tumor inside the salivary gland by using the Sialography. أكرر مرة أخرى شيئين ضرورية في اختيار هذه الطريقة. أولا هذه الطريقة ما تستخدم رأسا. أكو بها كونترا انديكيشن وأكو انديكيشن معين بها. هذه النقطة الضرورية الأولى. اثنين هي ما تعتبر البريليمينري دايجنوزس. لا تعتبر الطريقة الأولى. يعني عادة أكو السونار يستخدم قبلها. ولكن أيضا الموضوع الثالث اللي أرجو انتباه إليه if we suspecting that there is any malignancy, please do not confirm the diagnosis by the Sialography. أربعة أخوان مثل ما راح نشوف بهذه النقاط المهمة. هذا الكونتراست ميديا والتايم مال inserting the contrast media والدايمتر مال الكاثيترز اللي نحطه راح يختلف من سليفري جلاند الى اخر. يعني كميه الكونتراست ميديا اللي تعطى تختلف من الباروتيد عن السبمانديبول، والكاثيتر اللي يستخدم بالارسيرشن مال ذيس راديو اكتيف ماتيريال ايضا يختلف. هذه نقاط عمليه ارجو الانتباه لها لانه انت just a matter of time you are going to be graduate and you are going to send the patient for the Sialography as we are going to do in our dental clinics or in the patient that is attending to us. Therefore, I have to know the practical points. يجب أن كطبيب أعرف النقاط العملية لما أستخدم بهذه الطريقة. I'm not going to depend on the technical work only or on the technician. لازم أني أعرف هذه الطريقة بالتفصيل. هذه الطريقة بها precautions وبها practical points or clinical aspect. لاحظ البوزيشن مال البيشنت اثناء اعطاء الكونتراست ميديا. Here the patient could be demonstrating into supine position. You know what's the supine position, and we are going to use a special catheter. This catheter is going to be canalized inside a very thin salivary gland. الكاثيتر اللي يستخدم بالنسبه للباروتيد السايز مالته يختلف عن الباروتيد عن السبمانديبل salivary gland. ارجو انه تنتبه ايضا على السايز مالته. ليش؟ لانه الداكت مال الباروتيد السايز مالته يختلف عن الداكت مال السبمانديبل سيلفري جلاند. ايضا في بعض الاحيان نسوي dilatation of the duct, then we are going to insert the catheter. وطبعا insert of the catheter inside it is when and give the radioactive material that is considered to be as a very painful to the patient. And sometimes we are going to give انتبه النقطة العملية small amount of lemon juice and as the patient here we could demonstrating lemon juice and in order to increase the saliva production and affect the excretory types of the duct. Anesthesia should be provided for the patient مثل ما قلت لكم لأنه it is very painful. حط الكاثيتر. The contrast media is going to be administered until the patient is going to be feel the pain العفو. Then after that, wait the patient and you are going to take the patient X-ray to the patient. Look here, the mean injection about to approximate 0.1 ml per second. يعني يتم إعطاء الكونتراست ميديا يعني ببطء شديد وعلى تخنه. And the pressure which is going to be applied is not too much, not exceeded 75 milli زئبقي, and approximated the upper limit of the viral of the excitatory pressure in the salivary gland. إذا ماذا يعطى؟ تعطى الكونتراست ميديا. يتم استخدام أول شيء dilatation of the duct. يتم استخدام specific duct insertion. يتم استخدام الكاثيتر معين لكل tab of the salivary gland, وتحقن هذه المواد radioactive material into the duct, and sometimes you are going to give the patient anything to be sucked in order to increase the secretion of the saliva, وبالتالي يوضع المريض لمدة ربع ساعة إلى أن هذه المادة تنشر في داخل الداكت وبداخل السليفري جلاند, وبالتالي يتم أخذ الراديشن أو الإكس-راي. Look here, the contrast media, amount of contrast media is usually different between the glands. هذه النقاط العملية ترى أنا ما كاتبها بالمحاضرة, أرجو أنه تنتبهون عليها الآن, أنتم طالبين بها لأنه it is related to the practical points. Look here, the mil which is required for this, how many mil it is required for the parotid, for the submandible. The mil which is required, or the amount is required for the parotid, is more than the amount which is required for the submandible gland. Then after that, we are going to inject this radioactive material, taking into consideration the gravity systems أو الجاذبية بالنسبة للسبمندبل أيضا تختلف بالنسبة للسبمندبل gland. Then after that, we are going to take X-ray. What are the view which is required for that? Interior posterior view, subventricular or axial projection, lateral view or lateral oblique. The same kind of a projection for the parotid and the submandible. And the most احنا بالنسبة إن نخلي الأوبليك projection بالنسبة للpatient. وفي بعض الأحيان we try to change the projection which is needed for the X-ray in order to have the more visualization of the contrast media. And we are going to take a series of images. The time which is required for the Sialography is about 15 minutes. Until the patient may feel moderate tenderness or slight edema of the salivary gland. And you have to take the X-ray after 10 minutes and allow for the dynamic evaluation of the contrast media. إذا الطبيب demonstrating that the contrast media emptying is representing inside the parenchymal surface of the salivary gland too much and it does not emptying, يعني ما راح تفرغ هذه الكونتراست ميديا من السليفري gland. This may give us indication that there is sialodenitis or infection of the salivary gland or sialoctitis. يعني عدم إخلاء أو عدم خروج هذه الكونتراست ميديا من السليفري gland وبقائها لفترة طويلة, we suspect that the patient may have infection inside the salivary gland duct. مثل ما قلنا, this method is not going to be used always, and there is a specific precaution which is required. Here we have to investigating whether the patient have allergy to the contrast media, and take into consideration if the patient is planned to have isotopic examination of the salivary gland. And here we have to ask the patient if he's going to have examination of the thyroid gland by isotopic materials. Again, contraindication for the pregnancy, and because it is need an X-ray, please do not use this method within a pregnancy. If there is any damage of the salivary gland opening, when there is any tearing, whether it was a trauma or or the patient previously have been infected with a trauma, please do not use this method. If the patient have acute infection, that is to say, the patient now he is infected or before 48 hours or something like that, please do not use this type of method. هنا انت راح تحاسب اذا استخدمت هذه الطريقه اذا كان البيشنت في حاله الاكيوت infection, because sometimes you are going to increase the severity of the infection. طبعا اكيد كل method have an advantage and disadvantage. We are going to expose the patient to radiation, X-ray, ثم قلنا lateral هيك or posterior anterior, even though we are going to expose the patient to contrast media. And as I told you before, it is considered to be very painful to the patient, and especially when you are going to inject the radioactive material. Sometimes, if the patient may have a small calculi, and this small calculi could not be detected by X-ray, and we are going to use this type of method, we are going to dislocate it or push this calculi inside the duct. في بعض الأحيان ونتيجة دفع ديس الكونتراكت ميديا إذا كان هناك small calculi تكون موجودة ممكن أنه تدفع inside the duct, make it very difficult to be emerged outside this very duct. أرجو الانتباه إلى هذه النقاط. أيضا sometimes it should be remembered that air bubbles injected together with the contrast media may lead to stimulate the presence of the calculi, even though a painful or push the calculi inside the duct. Here we could demonstrating. Look, normal salivary gland, how it is going to be representing as a T, blanc. Here the duct of the salivary gland is open, and the radioactive material is distributing in all the salivary gland. لاحظ هنا في حالة طبيعية تكون بشكل أوراق الشجرة, leaf-like structures, tree-like, and the salivary duct is opening, as we could demonstrating that the radioactive material is distributing in all the duct of the salivary gland. While if there is any structures representing here, we could demonstrating by the salivary sialography. Here, if we are going to inject the radioactive material, look, dilatation of the duct, and look, the structures of the duct, it's not going to be passed through. سوف لن تذهب هذه الراديوactive materials or AOD into the other part of the salivary gland due to the structures. Another method which is used for the diagnosis here is sonar. The sonar of the salivary gland is very important, non-invasive type of method. It may be used for preliminary diagnosis. بالنسبة لي احنا المتعاملين كأطباء أسنان صار لنا فترة بالأورال ميديسين، ننقل لكم تجربتنا البسيطة أو تجربتنا في هذا المجال بالدايجنوزيس. بالحقيقة فحص السونار بالنسبة للسليفري جلاند جدا مهم ويعتبر هو البريليمري دايجنوزيس. ما مطلوب من عندك أنت طالب صف خامس تعرف تقرأ السونار مال السليفري جلاند. Please do not use this method or this issue unless you are doing well regarding this aspect, unless you have invasive information, يعني unless you have a lot of information. لكن اعرف المبادئ الرئيسية. إن شاء الله من when you are going to graduate and you are going to take the postgraduate, you are going to inform me how to read the Sialography of the salivary glands. عندما تتخرج وتجي تكمل دراسات ان شاء الله بالاورال ميديسين راح نعلمك شلون تقرا السونار مال السليفري جلاند، شلون تقرا السونار، شلون يبين بالاكيوت سايلودينايتس، بالكرونيك سايلودينايتس، بالجوجرين سيندروم كيف يبين السونار مالته، الليف نود شلون تبين، الكاركترستيك فيتشرز. ناو انت اعرف البيسك برنسبلز اوف ذا التراسونوجرافي. ما مطلوب من عندك تعرف تقرا السونار، لان هذا موضوع معقد شويه صعب يحتاج الى تخصص. لكن نعرف المبادئ الرئيسيه مالته وين we are going to use it. هذا يعتبر سيف. يعني شوف ذاك the previous method cannot be used for a pregnant woman because you are going to expose to radiation يعني Sialography, but in the sonography you could use it for a pregnant woman. She's complaining from swelling of the salivary gland. And if the patient is complaining from stylothysis, that is to say stone inside the salivary gland, and if there is a mass, it's going to be represent extraglandular, that is not inside the salivary gland. We could demonstrating if there was any focal, any diffuse type of tissue. Even sometimes it may be used to make a diagnosis between the solid and between the cyst. Even though sometimes I need to take a specific types of cell for the cytological examination to see if there is any pre-malignant types of cell representing, and I'm going to use fine needle aspiration, but this should be used in accompanied with the sonography. أنا متأخذ هناك عن طريق الفاين نيدل أو FNA لازم أستخدم وياه sonar, and I'm going to know which area I have to aspirating type of cell. طبعا هناك دراسات كثيرة العفو فيما يخص السونار لا تعد ولا تحصى مع السيلفري جلاند. يعني السنسيفيتي والسبيسيفيكيتي مالتها تكون يعني sometimes it's not 100% to differentiate between benign or malignant because we do further investigation, but as general talking we could differentiate between benign and malignant as a preliminary diagnosis. That is to say السونار يعطيني معلومات ابتدائية عن ما موجود في داخل السيلفري جلاند سواء كان solid سواء كان cyst سواء كان benign or malignant، ومن ثم انتقل إلى فحوصات أخرى، لكن بالبداية بالنسبة لي تبدأ بالسونار. ثلاث مصطلحات رئيسية أيضا ما موجودة بالمحاضرة، موجودة هنا، أرجو أنه تنتبه عليها، وهذا السبب اللي يخلينا أنا مميز الطالب اللي يحضر محاضرات من الطالب اللي is not attending the lecture. الهايبر إكويك والهايبو إكويك والايسو إكويك والإن إكويك، هذه ثلاث مصطلحات أو أربعة مصطلحات رئيسية تأتي مع الهايبر إكويك how it is going to be represent، بينما تكون على شكل أبيض. الهايبو إكويك تكون more dense ويكون لونها أغمق. الايسو إكويك and the inner إكويك تكون more dark and more dense. These common terminology which is going to be used for the sonography. The hyperechoic and hypoechoic, the most important two terminology which is going to be used. وهذا كلش مهم بالنسبة لنا أثناء فحص السونار بالنسبة للسيلفري جلاند. عادة sometimes it is going to be used for the diagnosis of the calculi. طبعا مو any calculi could demonstrating by sonar. Sometimes a small calculi could not be demonstrating. Sometimes it is going to be reproduced with a caustic shadow، يعني ظل معين يكون موجود بيها. لكن as a general talking بناحية عملية وعلمية وجود هذه الستون بداخل الداكت يؤدي إلى distension أو يؤدي إلى توسع the duct above the obstacles. يعني وين تكون موجودة هذه وراها diameter مالتها يكون عريض. And specify if it as a general talking smaller than 2 milli does not produce any caustic shadow. وهذه هي النسبة تقريبا 10% أو 20% إذا كانت صغيرة جدا. و sometimes you are going to make a diagnostic mistake within the small stone. والنقطة الأخرى sometimes in hyperechoic sometimes it's going to be misdiagnosed with the air bubbles. وهذه الهايبريكويك وهذا هو الهايبوإكويك how it is going to be demonstrated. بالنسبة لك كافي إنه تعرف الانديكيشن والكونترا انديكيشن، تعرف الأغلاط اللي ممكن أن تكون في السونار كيف تكون مثل ما شرحت لكم إياها، تعرف المصطلحات أهم تو تيرمينولوجي اللي هو الهايبر إكويك والهايبو إكويك كلش مهمة بالنسبة لك لما تقرأ السونار. Here we could demonstrating multiple hypoechoic area represented on the salivary gland. Another types of method, الهايبر. Another types of method هو CT scan مال salivary gland. The CT sometimes it is going to be used with a contrast media, pre or post, and we could use for demonstration of the calcification. And sometimes the tumor could be demonstrating, or malignant tumor is going to be demonstrating also. الآن راح نعرف المethod مال choice when we are going to use the CT scan, demonstrating the abscess, the calculi, and inflammation. وتعتبر more accurate than the radiography. In case of a tumor, we could know the extension of the tumor. And sometimes we could differentiate between the different type of a tumor. Even the calcification, or sometimes it is not considered to be as typically found for the diagnosis, but we need for further histological analysis or histopathological examination of the salivary gland. Even if the patient is suspected of any inflammatory disease, whether it was abscess or calculi, and use in patient with a contraindication for MRI. And we could demonstrating the extent of the tumor. And sometimes it is give us indication about the deep loop of the parotid gland, which is located behind the ramus of the mandible, which is very difficult to be diagnosed within the sonography. في حالة استخدام السونار يعتبر من الصعوبة جدا تشخيصه الديب لوب مال الباروتيد جلاند، وهنا يلجأ إلى CT scan. أيضا minor salivary gland in the case of presence of any lesion located in the superficial parotid or submandible. Here we could demonstrating the normal parotid of the salivary gland, how it's going to be represented, while sometimes we could demonstrating the process of the stone, and as a result there will be inflammation or separate of the inflamed inside the parotid. Another method for examination، إذا كملنا أعيش بصورة مختصرة، تكلمنا عن السونار والسيالوغرافي والCT scan. بقى عندنا two types of method of examination اللي هو MRI، طبعا يكون safe و non expensive. It is used for the diagnosis of the calculi or stenosis of the duct. طبعا حال أي طريقة sometimes a false negative reading may occur. يعني في كثير من الأحيان small calculi, and as I said before, if it's less than 2 milli, it does not cause any ductal dilatation, and it is very difficult to be diagnosed. And sometimes it is difficult to diagnose the solid calculi from the mucus. طبعا الديسادفانتج مالتها كأي طريقة ليها advantage و disadvantage: expense, limited availability, and contraindication. We have to ask if the patient have any pacemaker. Here we could see that the pleomorphic adenoma is mostly diagnosed with MRI. The more accurate picture of the salivary gland, it could be taken by the CBCT. CBCT مثل ما تكلمنا عليه بالطرق الأول مال الدايجنوزيس بالمحاضرات الأولى. It may present a high resolution مال computed tomography, resolution of the osseous structures, and here a lower radiation is going to be used than the CT scan. CBCT تنبيه كمية الإشعاع اللي يأخذها المريض أقل من السي تي بهواية، ويمكن من ناحية عملية أنه المريض يأخذ أكثر من CBCT مثلا، لأنه كمية الإشعاع تكون قليلة، لكن بالنسبة للسي تي سكان كمية الإشعاع تكون أكثر. And ممكن انه السكشن that we are going to investigating it may have a single rotation. ممكن انه تحصل بعدة طرق ونختار بالكمبيوتر ويعطيني more accurate types of method. يعني يعطيني 3-dimensional reconstructions and we could make a manipulation of the image rotation. يعني الايمج اللي تطلع عندي ممكن افرها بكل structure يعني بكل الاتجاهات وممكن اشوف السليفري gland in more than a view. ايضا it's going to be have a slice thickness. That is to say there will be cross section slice. And the dye system is going to be more clear imaging than any other types of method. لاحظ the superficial and the deep loop of the parotid could be well investigated. هذا الريمس of the mandible, the deep part, يتم استخدام الcone beam in order to investigate the deep, يعني not the superficial part, the deep part of the parotid gland. And here we could taking different manipulation. ممكن أفرض الصورة بأي اتجاه وممكن أشوفها بعدة اتجاهات in order to know the extension if there is any tumor to the surrounding area, and also I could be demonstrating if there is any swelling of the lymph node in the surrounding area. إذا ال CBCT هو يعطي طريقة أوضح من ال CT scan. ممكن يختار بعدة طرق، ممكن الليجنز مالتها تكون أوضح، ممكن الليف نود مالتها أيضا تبين بطريقة أكثر. طبعا يبقى الجولد ستاندردز in order to investigating the salivary gland is the biopsy. كل هذا سواء كان CT, MRI, CBCT, or Sialography or Sonography, we could not reach the accurate diagnosis of the salivary glands unless this swelling has to be carefully investigating or taking with a biopsy. This is a gold standard for the examination. We are going to use these types of method if there is any lump or swelling in the salivary gland. Also, we may have an idea about the duct of the salivary gland, whether it's going to be blocked or there is any malignant tumor to be removed. Also, in case of autoimmune disease, الجوجرن syndrome اللي راح نتكلم عليه بالتفصيل ويعتبر autoimmune disease. We are going to use a biopsy in order to confirm, وعادة البايوبسي مثل ما راح نشوف تأخذ من اللور ليد. Another types of investigation which is used for research method اللي هي serological test. And here we could demonstrating the presence of the ESR. And sometimes if the patient is complaining from leukopenia, anemia, normocytic, autoantibody, an anti-nuclear antibody, anti-double strand, يعني immunological anti-nuclear antibody, the IgH, all of these, the SSA, the SSB, these considered to be as an immunological method in order to use for the diagnosis of the Sjogren. إذن هناك كرايتيريا تستخدم بالجوجرن مثل ما راح نشوفها بالتفصيل، ولكن السيرولوجيكال تيست may play a great role بخصوص الانتي اس اس اي ار او والانتي اس اس بي ال اي. In addition to the anti-nuclear antibody and the rheumatoid factor should be positive in order to confirm whether the patient is complaining from an autoimmune disease. In the serological evaluation, we have to send the patient for a complete lab picture, differential cell count, morphology of the cells. We could demonstrating the ESR, leukopenia, whether the patient is complaining from anemia, والimmunological study اللي هي الانتي نيوكلير انتيبادي، الانتي دبل ستراند، الاي جي اتش، الاس اس اي، الاس اس بي، واللي تعتبر highly specific for the Sjogren syndrome. اعتقد ان هنا we covered all the method. اعيش بصوره مختصره تكلمنا به. تكلمنا عن الميجور سيليفري جلاند، تكلمنا عن الماينور سيليفري جلاند، تكلمنا عن الاوبننج بالاورال كافيتي، كل داكت شلون تفتح بالاورال كافيتي، تكلمنا عن التايبس of the salivary gland as a general, serous, mucus and some or mixed. تكلمنا عن الميثود اوف انفستيجيشن. قسمنا هذه الميثود into the sonar, into the Sialography, الCT scan, الMRI, the CBCT, in addition to the serological examination of the salivary gland. كل طريقة أو كل ميثود مال الاكزامينيشن اللي تستخدم بالدايجنوزيس لديها ادفانتج ولديها ديسادفانتج. ما مطلوب من عندك أنت كطالب صف خامس تقرأ لي سونر مال salivary gland، ولا مطلوب من عندك تقرأ MRI، لكن لأن هذا it's need يعني هو qualified skill in this field. لكن المطلوب من عندك when we are going to use this type of method, what is the advantage of this method, what is the disadvantage of this method. Why مثلا we do not use a when we are not going to use a Sialography. مثلا ممكن أن يعطى إلى كيس معين، مثلا patient يعاني من acute infection وأقول لك اعطيني الميثود of the examination، كيف السكس مال الاكزامينيشن مال هذا المريض. هذا هو المطلوب من عندك، لكن تفاصيل المنلة والفرق شلون تقرا الCT والMRI it is not recommended for you. هذا مو شغلك، من تختص وتجي يمنا تكمل اورال ميديسن ان شاء الله بالدراسات العليا نعلمك على هذه الامور. But till now you have to know the basic general principles of the salivary gland. Till now the salivary gland disease first lecture have been end and finished. It is 10 o'clock now, and if anybody needs any question please do not hesitate. إذا أي واحد عنده أي سؤال احنا موجودين. اوكي موجودين بالجوجل كلاس روم.
نعم دكتور.
إذا واحد عنده أي سؤال احنا موجودين. أعتقد رابط الحضور نزل عليكم. إذا أكو أي سؤال أو أي استفسار احنا حاضرين وباقين وياكم. ومرة أخرى نتمنى لكم عيد سعيد والموفقية إن شاء الله.